interested. For those of you who are interested in an experience that is maybe surgery specific, specifically maybe orthopedic surgery, you can use the medical specialties filter here. Dial into orthopedic surgery, and you'll see it will now tailor the results to the options that are available. You will notice that these are all in-person experiences, and we do have, it looks like, 6 different options to choose from currently. Now, we are always onboarding and recruiting new physicians to host on our platform. We want to make sure that those physicians who are working with us are ready and willing to provide the experience to teach and to provide letters of recommendation based on merit. So one experience I want to pull up right away is going to be our inpatient experience through St. Anthony Hospital in Chicago, Illinois. It's a great experience to get exposure in an orthopedic surgery department in a community hospital in the US. St. Anthony Hospital is a teaching site.
Ryan, I'm sorry, but your internet connection is going out. So I'm going to have to take over, I think.
Okay, I'm sorry about that.
I don't know, it's coming in and out. It's pausing.
Okay, thank you, Dan. I'll stop sharing.
Okay. Sorry about that. We had some technical issues today, which happens from time to time. But let me just reintroduce myself. My name is Daniel Rivers. I am the Partnerships Director for AMO. Again, we work with Quexst in India to service medical students and doctors for U.S. clinical rotations. We do have some programs in the UK. As my colleague Ryan was just going over, there is a dashboard and a search function. After you upload your passport and your resume, you're able to create applications for free. And as we go through the webinar today, please do post questions in the chat, and we will kind of get to all of your questions. Just continuing with kind of the presentation, there are many benefits, whether you're a graduate or a medical student. All of our programs are going to allow you to kind of build your CV even further. With more than 70 kind of specialties offered, many doctors reserve programs where maybe they weren't able to take that specialty during medical school. Or maybe you are a cardiac surgeon in India and you want to see, what are the latest techniques used in the United States in cardiac surgery. We have many doctors that come from around the world to our programs, either in person or virtually. And I will talk about virtual. I did see many of you say, I'm really only interested in coming in person. This is a common theme, especially across India. But I have to say that our virtual programs are equal to in-person programs in terms of outcomes and learning environment and the U.S. residency match. Whether you do virtual or in person, obviously you're going to build your English and learn new terminology and especially earn those letters of recommendation. All of our programs will result in earning a merit-based letter of recommendation from the preceptor. This letter can be uploaded to the ERAS application for the U.S. residency match. And as I've said, whether you do a virtual program or in person, those letters carry the same weight. So they are equal, whether they're in person or virtual. And actually, we had many visitors that only did virtual rotations last year, and they were able to match for residency this year in the United States, even though they had never actually been here in person. So those virtual programs are really amazing, and I would urge you to consider them. Now, I did see there's at least one medical student here. We do work with medical schools across the world to ensure that you can receive elective credit. Most medical schools in India do not allow you to receive elective credit doing away rotations, but we do work with various medical schools across India. And then expanding your network. That's a big one. So whether you're a medical student now or a doctor, taking part in a clinical experience in the United States is going to allow you to kind of develop relationships, become friends with other doctors, students in the United States. Often those can become lifelong friends, people you can communicate with. It really depends how much effort you put into the clinical experience. but we will guide you along the way so that you have the best outcomes from any program you select. We do have programs with kind of top hospitals and residency directors, Harvard, University of Miami, and many more. But we also have programs with kind of clinics and private practices. It really depends what you're looking for. And my colleague Ryan here does a lot of advising to potential visitors, whether you're a doctor or a student, on kind of what program will meet your needs, kind of your medical education and career goals. Now, generally speaking, this is general, medical students in year 1 and year 2 would do an observership. Medical students in years 3, 4, 5 would do a hands-on rotation. If you are a graduate, you've already graduated, or maybe you're a doctor now in India or another country, you would do what's called an observership. If you have taken and passed USMLE Step 1, even as a graduate, there are a few programs where you can do hands-on rotation as a graduate, but that's only if you have taken and passed USMLE Step 1. Most doctors around the world that participate in our programs simply do observerships, but let me be clear. You are not just standing there observing. It's not like that. You are actively engaged with the preceptor, performing differential diagnoses, giving active case presentation, reviewing exams and tests, blood work. Depending on the specialty, there are various levels of observership, so and hands-on as well. So you will not feel that you are just standing there watching. Whether it's hands-on or observership, you are actively engaged with the doctor. The only difference is with hands-on, you are actually physically, engaged with the patients. With observerships, you're only engaging with the doctor before and after the patient's exams. And, we can always add more information. But if you have more questions about that, I know Ryan did post a meeting link, and you can always schedule a one-to-one meeting with our advisors to kind of talk more about which program is kind of best for your goals. Now, with virtual programs, these are well developed. These are the future of medicine and medical training. Look, you are allowed to work with a preceptor from kind of a top university, say Harvard, from the comfort of your own home. This can be a little difficult from India because of the time zone difference. You may need to do many of your hours at night, but you can take part in these programs without having to travel to the United States and still get all the same great outcomes of a clinical rotation, clinical experience. We also have many research options. As I've said before, the letters of recommendation from virtual programs carry the same weight as in-person programs, and we had many successful candidates secure residency spots in the U.S. this year, and they never came to the U.S. They did all of their kind of clinical experience virtually. We do work with the residency director of plastic surgery at Harvard Medical School, and he essentially said these programs are not going to go away. He will continue to offer telehealth and virtual rotations through AMO. Another one of our doctors basically said that telehealth is even better than in person, because through the virtual environment, she is really going to get to know you well, to write a very good letter of recommendation and really enhance your clinical knowledge because there are no distractions in a virtual environment. Ryan kind of showed you how it works, but I can just go over it really quickly. Again, I know he just took you on the platform, but let me just kind of continue what he was showing you. So basically, when you get into the platform, you can go to the My Documents section. There are a lot of free resources and guides. So please take a look at those. They can be helpful to you. In the Documents section, you're going to want to go to Personal Documents right here. Upload your resume and your passport. If we have those 2 documents, then you can create applications in the United States and the UK, and you can then, we can approve those applications. Now, every single program that we offer has a complete program description. I urge you to read those, including academic affiliations, hospital affiliations, expectations, and what's really important is who it is best suited for. So if you are already a doctor, make sure that medical graduates is listed in the program description. And then how many patients you're going to see each day, as well as many other information about the program, including the schedule. Now, under the search, most people right now, due to the pandemic, are still reserving virtual rotations, and we expect that to continue into the future. Currently, 80% of US physicians are using online telehealth in some capacity in their practice. So learning how online telehealth is being used to diagnose patients is very important for any doctor or any medical student. And virtual rotations will only continue into the future. Lots of great programs to choose from virtually, although we do have in-person programs as well, and we do support you with your visa and housing and flights and everything you need. But do take a look at the virtual programs, really great options in a variety of specialties. Now, going back to the webinar, our advisors are there to kind of guide you, provide you one-to-one support in selecting the right program. Once you reserve a program, we work with our partners at Quexst to help you with any of your needs, and we will assign you a one-to-one success coach. That coach will help you to collect your documents, get you enrolled. If you're doing a virtual program, we will do a systems check on your computer to make sure your internet speed is fast enough that your computer can log on to the virtual platform. If you're coming in person, we will support you with visa, housing, flights, everything that you ask for, we will help you. We work with medical students and doctors from more than 180 countries. So we're very familiar with the process. We know that you're very busy, and we're here to help you along the way. Now, there are going to be a lot of documents in order to enroll, but you don't need to worry about this. Again, we work with, India is the #1 source of doctors that become doctors in the United States. So we're very familiar with all parts of India, how these documents look, and we can help you to kind of give you advice in collecting them and getting them in on time so you can start your program. We have reviews from around the world. I will send you our reviews from India, many of our past visitors, so you can kind of read their stories. Here's one from India. During my rotation, I saw more than 400 patients in the United States in 4 weeks. I took medical histories and made physicals on hundreds of patients. I also observed more than 30 thyroid ultrasounds and biopsies. So that's just one quick review of just one visitor we've had. But we have hundreds of reviews that you can read. Maybe they will help you to kind of learn more about, making decisions about any further education, including clinical experiences in the United States. Now, about 27% of US physicians are foreign trained. And many of those do come from India. India is the #1 source of US doctors. But again, US is also a top training location. So even if you don't want to become a doctor in the United States, I can assure you that all the programs we offer for graduates, many of them are only for graduates. We do have programs that are really meant for doctors to just get some advanced training in your specialty. Some doctors do bring their family when they come to the United States, so their family kind of gets a vacation while the doctor, works at the hospital for that 4 weeks. Now, there are a few of you that said you are interested in the US residency match, so I just want to give a bit of information, and then we're going to open it up for all your questions. Now, in the year 2020, we saw the highest match rate ever for international medical graduates, around 61.1%. In the year 2021, this year, that percent went down a bit to 57%. But the actual number of people that matched went up. There were simply more applications this year. Now, in some specialties, it's much easier for you as an international medical graduate if you want to become a doctor in the US. Specialties such as kind of neurology, pediatrics, family medicine, and internal medicine. The match rates for those are much, much higher, 80, 90 percentile. But programs such as residency in maybe plastic surgery, dermatology, neurosurgery, really any of the surgical fields are much harder to match into. In order to match into any field, you are going to need US clinical experience, and you can do that virtually or in person even before you take USMLE exams. And I highly encourage you to do at least one clinical experience before you start taking any USMLE exams. So with that said, I'd like to open it up to Ryan and kind of questions from the audience. I do like to leave a lot of room for questions because you may have very specific questions about orthopedic surgery or other specialties that we would like to kind of dive into. Ryan, did you see any questions that have come in already that maybe you'd like to touch upon? And in the meantime, I'm going to pause recording. So if you're watching this recording, feel free to reach out to us at any time. And I'm going to allow all of you to speak. So if you would like to talk, I will go ahead and turn on your microphones. Ryan?
Hey, Daniel, hopefully the internet is better.